Hey everybody, Dr. Sterling here, and I wanted to tell you today about a condition that I see a lot of in my practice, and that is carpal tunnel. So a lot of people will have pain, tingling, or numbness in their hands. It'll go from their thumb to their first two fingers, or just their wrists hurt and they don't know why. So I wanted to just go through what it is, and if you have it or if you have anything that's pretty similar, then I want you to know that something can be done about it, and I want to show you about it. So follow me. I have a fellow coworker here, and a lot of people are at computers in the Silicon Valley, obviously. So where a lot of people feel the pain is in their wrist here. It can be the back of the wrist, but the carpal tunnel is actually a ligament that runs here across your wrist. And you have a nerve, the median nerve, which runs down the middle of your wrist, and it goes to these three fingers. Carpal tunnel is actually 3 times more apparent in females than it is in males. So the reason why that can happen is, or any carpal tunnel symptoms can happen, is you have increased fluid, increased tightness here, increase anything in here that compresses on the median nerve and the tendons in this area. So although typing does not necessarily cause carpal tunnel, it can aggravate it, or if you're texting, all of those things can cause it to flare up. It's often worse at night. The idea is that you want to stretch out this area of your wrist and anything that's impacting the carpal tunnel area of the wrist. So what you'd obviously want to make sure that you stretch this and that does not cause pain. You just want to stretch out the wrist in all different areas, but you don't want to re-aggravate the pain. So you have to find out first what causes the pain, and then how to stretch and allow this area to become more loose, to allow the nerve to flow properly, allow the tendons to work properly, because oftentimes it can be difficult to do fine gripping or movements with these fingers if you have carpal tunnel. So you want to restore all the motion, and where that comes from and where the problem is happening is right in here. So you can do ice to reduce the inflammation, you can do stretching to restore the movement, and also adjustments in this area. You have a lot of carpal bones right in here, also the elbow, the shoulder, and the neck. All of these things can be having an impact. So you have to do a thorough exam to know what it is, and then you can treat it accordingly. You can actually get some PT or chiropractic work in the general area, as well as where the nerve comes from, which is in the cervical spine. So there are a lot of things that can be done, and I would not go and get a steroid shot or surgery. I would try a non-invasive approach first. Results can be gotten, and you can get out of that pain. So if that sounds like you or somebody that you know, come on in, ask me some questions, let me know. Would love to help you out.